everybody. This is step one video. Our topic will be identifying where you have county level data versus LME, MCO, statewide or state level data. And I can think of no one better than Melinda to talk about this comparison and the strengths and some of the limitations we may have, especially since Melinda's been involved with especially the LME MCO data that we're using for many, many years. So Melinda, I'll give it to you.
Yeah, and this step is really kind of a nuts and bolts based upon the unique characteristics of our system and what data we currently have. And it's really to set you up to make it easier to complete the template. So this isn't so much about why you do an assessment and how you do assessment. This is really a piece that's setting you up on how to piece it together a little bit easier. And so for the first thing, when you look at the first column, you will always see at the beginning of every section a place to enter the data source as well as the population. As you see with the first example, this example shows consumption data, and it shows the 2017 Youth Prevention Survey, which most people will be using for their assessments. And it also shows a box to select the population. At the top of every single section is the state supplied data sources. So those come before anything else. There is a drop down and select box. And so you can either select the state source or you can type in your own source for this particular data point. That's in every section at the top. The same thing is true for the population. The state source is always there, and you can simply type over it to change it if you have your own local data. The first example we see shows what that would look like if you selected the state data source. The second example, which is for column 3, which is our intervening variables, shows what that would look like before you've entered anything. So it says select or enter the data source and select or enter the population. So again, that's at the top of every new section. So it's at the top of the consumption data, how much people are using substances, the consequence data, what kind of negative effects are they seeing? Often those are emergency department visits, deaths, those kinds of things. And then intervening variables is in column 3, and those are those things that look at what's contributing to these problems in our community. So some people might call those the root causes, is a very common thing to call those. When we're looking at this, as a general rule, most of our consumption data is going to come from the LME-MCO level data. That's going to be primarily the Youth Prevention Survey from 2017. If you have a survey that you've done in your community, that would probably be your survey data, could take the place of that if you have that same measure that's being asked about. Consequence data is primarily at the county level. That is things like emergency department visits, deaths, alcohol crash fatalities, those types of things that are the bad things that are happening, that are also often the things that can help our communities rally to a problem. And then intervening variable data is going to be mostly LME-MCO level, and that's going to be mostly the Youth Prevention Survey data. So that's going to be questions like, where did you get the alcohol that you drank? How harmful is smoking 2 packs of cigarettes a day, and so forth.
You know, Melinda, as I look at this, it's really, really important to understand the differences between consumption, consequence, and intervening variable data. Because if you understand what that really means, not only in defining characteristics, but develop the ability to explain what those concepts mean to other people and practice with maybe family members who don't understand what you do or don't understand these terms, or other agency staff people, practice teaching individuals outside the prevention field or even within our field what these three terms, consumption, consequence, intervening variable, means. If we can raise our level of conceptualization and understanding for these terms and concepts, then the template will become a little bit easier to conceptualize as a whole.
Absolutely. And these points of data, they can also really kind of make up your elevator speech for when you're thinking about what your problems are in your community, what you want to do about it. So they are definitely important to be able to explain to your communities and to be able to talk about.
I shared with Melinda and some other folks today during my Spiff Sig days. I was growing somewhat confused myself on the relationship between consumption, consequence, and intervening variable data. So I found a couple of stacks of Post-it notes that were different colors. And I used yellow, for example, for my consumption data. Blue, I'm randomly picking colors here. So it was a long time, so I can't remember. But blue for consequence and green for intervening variable. And I laid those items on a table. And I started moving things around, trying to make some connections. And it really helped me with my understanding. And we actually did the same thing with our advisory group. And it helped them with their understanding, because we were giving much more than just the definition. We were giving that definition a living, breathing, graphical representation. So we increased our ability to not only understand what that meant internally, but in teaching others, we understood what it meant at a greater level, a deeper level as well.
Yeah, and I've used similar kind of tricks. I often draw things out on a whiteboard or even on a piece of paper to draw how I think things are connected. And I'll use symbols such as color or underline, providing an asterisk, those different types of things that you can make to have things look different. But there's something about seeing it in a big picture that helps it makes it easier to assimilate what it means. Mm-hmm. And so that is a very good way to kind of break that down and make it easier to think about different pieces of that puzzle.
Right. And this may be somewhat of a controversial topic, and Melinda may walk me back from this, but I would say have a goal of understanding your data before you enter that into the template. If you expect the template to help you with your understanding, it's not initially. If you understand it prior to, then the template will help you raise your level of understanding. But if we don't have a baseline first, you may find yourself more confused than we need to be.
So you're going through those processes of understanding your data with your community and coming to decisions. And so this is your documentation.
Mm-hmm. Yeah, certainly. We have a really good slide that follows up with that thinking, so to speak.
Yes.
And some of the required versus optional. And Melinda, I will let you go through this with us. Then I may have a question or two that I've heard.
Sure. And there's 3 slides kind of related to this piece. These are very technical in terms of the documentation that you're going to provide for your assessment. So the first thing is all the measures that are written in black text are required. So you can see in the example on the left-hand side of your screen, 30-day alcohol use, local prevalence and state prevalence, local trends and state trends are a required entry. Where the items on the right-hand side of your screen that are written in gray are optional. Those are things that you could include if you wanted to. There are reasons why you might want to include some of those optional items, and there's reasons why you might not want to include some of those optional items. And I'm going to talk more about that in a moment. But just remember, those are things that you're going to want to think about thoughtfully and not include them just because you have them and not skip them just because you have them either. But the black items are required, so they should generally give you a picture of what's happening in your community.
And Melinda, you may mention this in just a few moments. Suppose my local data or local trend data is not available, or the reliability or quality of my local data is questionable. How do we handle that?
That's an excellent question, Jamie. We know when we design this that a lot of times the state doesn't even have trend data or disparities data, but we feel like it's important to include where you have it. And so we wanted to ensure this could be flexible depending upon your data, local data availability. So we always included a place to include local trend data, disparities, but we did not make it so that you had to have that data. And the way we've done that, as you can see in the example on the left, there is a drop-down option that you can select none available. And that's how we'll know that you didn't just miss this, is that you've selected none available. And then you can see on the right-hand side of the screen, you can see that the original entry showed select or enter. And so if you had no data, you could just select that none available. If you had data, you could type it in. And if you had data but you had concerns about it, you could type in that there was data, but there's significant quality concerns, or something to that effect, just to show that you have it, but you're not confident. So wouldn't need to be a long note, just a real short note to say questionable quality would be fine. And that would tell you why you didn't include that when you look at it later, because I don't know if you're like me, you might look at this a year from now or 6 months from now and you knew it while you were working on it, but you might forget. And so writing in that option helps you know how you decided to use that data.
Wonderful, Melinda. And also, this is a perfect example for reaching out to Melinda or Bill or myself. If you have questions about the quality, or you're uncertain about some local data sources you may have, or how to interpret that, or to include it, and what steps to take, it's a really good opportunity to reach out to us and say, yeah, we have this question about this really specific item. Feel free to contact us. This, again, we exist to serve you and your needs through this assessment process. So don't feel as if questions like that are too small to ask. Those are actually the questions that build a really high quality product at the end as we go through the process.
Absolutely. One of the things that I alluded to earlier is the items in gray. They are optional, and they're optional for a reason. Sometimes they're optional because they're not in the state data source. Sometimes they're optional because you could get so much data that it was overwhelming. And so because we can get everything doesn't mean we should get everything. So the greatest use for the optional items, it's always good to add trends if you have them. It's great to add disparities if you can. It's certainly great to add additional intervening variables if you have them. The state source resource is not comprehensive, so It's nice if you can expand that. But when we're thinking about our problem data, one of the greatest challenges that we had last year is people had a lot of data. Very often those data sources had very similar findings. And so having a lot of data didn't really help us decide if we had a big problem, but it did overwhelm us. And so what I recommend for when you're deciding about optional data, particularly for your problem data, is I recommend you look at that if your required measures tell you a different story or it's not clear what's going on. So an additional data source, when you have data that seems dissimilar, it can help you to make a decision. And so I would think about in each case if I want to include that optional data, particularly again for the consumption and the consequence data. I would probably include it most of the time when I'm looking at intervening variables, because those are what help us to understand why a problem is occurring, and it does help to have that's one place where it's especially helpful to have more data. But in terms of defining a problem, sometimes more data creates more overwhelm than help. And so we really want to use it more strategically there.
I'll share an example of experience I have. I've taught undergraduates human resources research methods or human services research methods for juniors and seniors in human services and counseling programs for years. And without fail, I can predict how the first day of class is going to be. They see this really large textbook with a very intimidating topic. In the middle of it has a significant number of chapters on statistical concepts. And I have to spend the first day of class talking about what we will do, what we will not do, to remember that this is everybody's first day, and it's not as bad as you think it's going to be. But most importantly, with this particular topic set, it's really easy to get overwhelmed and have your scope way too wide for the availability of time, resources, the actual request of the process or the funding source. Yeah. So it's their natural instinct to believe more is always better. But generally speaking, that may not be true. And it's a lot harder to say no than yes. So just because it's there in terms of data sets doesn't mean that it's not good data, because it could be. But is it the right data for the questions being asked?
Yeah, it's really just a question of being strategic. Sometimes more is better, and sometimes it doesn't add value. And so that's what we really want you to ask yourself when you're thinking about the optional items is, will this add value or will it just make it harder?
Melinda, I think we have a missing measure question. And we talked about some of this just a few minutes ago when I asked my question right in advance.
Yes, we touched upon this briefly earlier. The template was designed really with exactly the state level data sources included. If you have local data sources, that means there are things that are not there. And we wanted to make sure that we could address that with the template. And that's actually one of the reasons for some of the length, is because there's places in there where we wanted you to have the ability to respond to something, but it was things that you may not have. And so if you don't have anything missing, that's fine. You don't have to add any of those additional measures or additional data sources. That's fine. You may skip those. But if you are in a situation where you have them at the end of every single section, so at the end of the consumption data, how much people are using substances. So whether that be 30-day substance use or controlled substance reporting system data on prescribing, alcohol consumption in your community, whatever those might be, if you have consumption data, there's a place at the end of each section to add that. At the same thing at the end of consequence data. We've included all the state level measures that are available, but there's a lot of other things that some communities might be able to get. Some communities might be able to get their suspension and expulsion data from their schools. They might be able to go to their local law enforcement and be able to get underage alcohol charges. They might be able to go to their public health department or their hospital system to ask about how many emergency department admissions did they have related to marijuana vapes or edibles. So there's a lot of other measures that you could have potentially gotten, but that were not available systematically statewide. And so we wanted to have a place where you could add those. And so what you'll see at the end of every single section is data like that's similar to the box on the right, where it says enter your data source for additional measures, enter the population. So for example, enter the data source, you would say Chatham County Pride Survey 2017. And for the population, you would say middle and high school students, for example. And so you can write those in, and then you would next include exactly what the measure was. So, for example, it might be emergency department visits related to marijuana. And so you'd type in the number of emergency department visits for your population. If there's trend data, you would include that as well as if there's disparity data. So there's a place to put those things in if you have things that are really going to contribute to your assessment. And there's places where we have really strong assessment data at the state level, and there's places where it's pretty thin. For example, we do have a fair bit of data on alcohol. We have a lot of data related to opioids. We have almost no data related to marijuana, and not really a lot beyond tobacco inspections and 30-day use related to tobacco, including vapes. And so if you have those local data sources, those are things that you would probably want to add to really have a good, strong assessment.
We'll move on to, this is the last conversational report for this step.
Yeah, so one of the things we wanted to ensure, since we don't know what data people are going to have that they might want to add, but we know some communities have additional data points, we wanted the template to be able to be flexible so you could add the kind of data that you want to add. So you could add qualitative data just like you would add the state supplied measures. That's going to be your survey data, any surveillance data you have. And so it's going to say things like, it's going to be a hard number, % of youth who perceived vapes as harmful. Sorry about my pause. I'm thinking about an example. Some of that data might be qualitative, and this is probably going to be especially true for your intervening variable. And so there's a way that you can add that. As you can see in the example in the bottom box, There's always a place to add the data source, the population, describe the measure, show the local prevalence and the local trends. And so this example shows you had a task force meeting with alcohol law enforcement. You included your key task force members, which these members are pretty similar what you would hope to have on an alcohol law enforcement task force. It's got the sheriff's department, the police department, it's got your people from your judicial.
Okay, Melinda, thank you so much on the conversation about measures and qualitative data. And remember the differences between quantitative with an N and qualitative with an L. Quantitative is generally numbers-based, statistically focused. Qualitative, frequently you're looking at narratives or collections of observation that can be turned into quantitative long term, but that's not what we're asking you to do. We're asking you to try to interpret that qualitative with an L information that's coming in.